What we're going to do now is to look at the shoulder and we're going to examine it. I'd like you to pop that strap off on the bad side. Let me help you there. That's it, nice and slowly. Don't rush. Thank you. Is that sore?
Yeah.
Take a little step over just so that you're that way there. Good. I'm going to use a goniometer just to measure the range of motion. So let me just start with flexion. So if you could lift the arm up as high as you comfortably can.
Ah.
Okay. Again, we don't want to do it so that we're tweaking it too much.
Oh, it is hurting a lot there.
Okay, so around about 100 degrees there, and slowly down. Good. Sorry about that. Again, I don't want to force it so that it's too painful. Yeah. Let's see sideways how far we can go there. It's around about there.
Yeah.
It's 55 degrees. Straight backwards if you would. About there.
Yep.
30 degrees. And last one, tuck the elbow into your side, and we're going to let the arm come outwards as far as you can.
Here.
To about there. It's 25 degrees. Okay. Let me just write that down if I may. You stay there for a second. Good. I'm going to have a little examination of the shoulder now. I'm just going to press on some of the areas. I might just ask you just to stand a little bit over there if you would. Good. Okay. So I'm just, first of all, we're just going to feel the front of the shoulder. Let me know if that's painful there.
Yeah, it's okay.
It's okay?
Oh.
There?
No. Oh, that hurt.
Okay. This time we're going to look at the side. Any pain there?
A little bit.
Just there?
There.
Yeah.
Yeah.
And last of all, we're going to look at the back of the shoulder here. Just pressing.
Ow!
Okay.
There.
I'm just going to have a look at the shoulder again. Just going to have a look at three areas: the front, the side, and the back. And we're just going to see if we can find, if we can reproduce some of the symptoms. So how's that feel there?
Oh yeah.
There. Okay. And at the side.
There.
There?
Yeah.
Yeah. And last of all at the back. Is
Oh,
that really
yes.
soft? Just there?
Yes.
Yeah, well done. Okay, thank you. Fine. I'm going to run through a few simple tests. Just want to check the integrity of what we call the rotator cuff muscles. Because when we press here, this area is where the rotator cuff tendon comes in. So it's a little bit tender. It could be that there's something pinching there. So if we run through a few simple tests, they shouldn't really hurt. What I'm going to ask you to do is to lift your arm up sideways to there, about there. And I'm going to come and push you gently inwards, and I'm going to ask you to resist my force. So I'm supporting you on this side here, and just resist my force there. Any pain?
Yes.
I'm going to do that once more. And push. Easier?
A little bit, but still
bit
hurts.
painful. Elbow there. Keep the elbow locked into your side. This time I'm going to bring you inwards this way. Okay, I'm just going to support you here. Getting close.
Oh, it hurts.
That hurts there.
Here.
That hurts down there. Last one. I'm going to ask you to stay in that position, but this time I'm going to bring your arm this way. Okay? No problems.
Oh, hurts.
And that hurts. Again, all sort of triggering off there. Okay, you're doing really well. Thanks. Good. The last one I just want to look at is your biceps. And I'll ask you to hold yourself there. And again, what we're going to do is resist you here. Does that get it there?
Yeah, it does hurt a bit, but not as much.
Okay, and we're going to do it from there.
Ow!
Good.
It hurts more from there.
Okay. Okay, we're just going to have a little look at your neck movements. Just drop your chin forwards if you would. Any pain there?
No.
Good. And look to the left and to the right and forwards and backwards. There's no pain there.
No.
And it doesn't shoot any radiations down. And just gently bend forwards a little bit there. No pain?
No.
Good. And come back up. Fine.
It hurts a bit if I do like this.
Yeah. What sort of pulling here?
Okay.
Is it? Yeah. It hurts where? In the shoulder or here? Along
no, here.
Yeah. Okay. That's fine. Right. Having looked at it, it's definitely got a capsular appearance to it. It definitely looks like it's a frozen shoulder. You can face me this. Okay, so the thing is whether you might have also an underlying injury to one of the rotator cuff muscles. We won't know that really until we've started to sort of work through it and treat it a little bit. Sometimes people can injure the rotator cuff first, and then they get a secondary frozen shoulder on top of it, which makes it complex. The only thing is, obviously, you've got very, very restricted motion. You know, it's quite a nasty sort of case there. But I think you'll find the treatment should work quite well with this. Okay, look, we've completed the case history. Before we start some treatment, I'd like to run through a consent form with you. If we just go through it, I think that you're in phase 2/3. So if I explain to you what it says here, if you're in phase 2, you may require between 5 and 9 sessions depending on severity. It may take up to 3 sessions to significantly reduce the pain. If you're diabetic, it can take longer. If your frozen shoulder has come on following a major trauma or surgery, it can take longer. That's not you. Treatment can be painful, but is usually no worse than the pain of a frozen shoulder. Our commitment to you, we'll do our utmost to help you through your condition using this unique hands-on treatment method, the Neil Asher technique. All the practitioners at our clinics are registered with official state governing bodies. They will have their own insurance. And you should see a tangible, measurable improvement after each treatment session. That's our promise to you. In the unlikely event that you report no improvement after 3 or 4 or 5 sessions, your case will be reviewed by a senior consultant. Unfortunately, there's no one more senior than me here. But you're free to pull out of treatment at any time. So if you commit, there's no commitment there. And if you're not happy or you have a complaint about your treatment, we operate a confidential and impartial complaints procedure. Does that sound reasonable?
Yeah.
Well, let me leave you to think about that and sign it if you would at your own time. Okay, I'll leave you while you get changed. Thank you. Today we're going to look at the case history, how to take a case history. Teresa's very kindly agreed to come and be a model for us. I haven't treated her before, and we're going to go through a case history, an examination, and then some treatment of Teresa. Okay. So first of all, have you ever been to an osteopath before?
Yes.
So you sort of know what we do.
Yes.
Okay, we all work a little bit differently. What I'd like to do today is to go through a case history, which is a few basic questions, have a look at you, give you my opinion and my diagnosis. We'll probably take some measurements of your shoulder, and if appropriate, we'll start some treatment today. If I feel your problem is not within my particular realm of expertise, I'll tell you what I think is happening and who or what might be more appropriate. Okay, so we'll just start with a few basic questions. Your full name, please.
Teresa.
Mrs., Miss?
Miss.
And your address?
18.
Phone number?
0208.
Your date of birth?
26. October. 10. 61.
61. So that makes you...
43.
Good. Who's your doctor, your GP?
It's got Dr. Whittington.
Whittington.
I haven't got the telephone number here.
Okay.
I can bring it.
Perhaps next time. What do you do for an occupation?
Right now I was working in a restaurant.
Okay. Does that involve a lot of physical work, sort of lifting and carrying?
Yes, chopping.
Chopping, yeah. How long have you been doing that for?
3 years.
3 years.
But this last year I haven't worked.
Not for a year, because of the shoulder?
Yeah, yeah.
In your background, do you have a background of physical work with the shoulders? History?
No, I do sports a bit.
Sports? Any sports or hobbies that you...
No, like tennis or whatever, none.
Nothing now, but in the past maybe a little bit?
I wouldn't say that.
Okay, fine.
That